about to experience Healthline, a show where doctors from 𝗛𝗏𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗛𝗏𝗵𝗹. Thanks for joining us on this Monday, August 14, 2023. Okay, and indeed, you've got questions, we've got answers. So if you've got questions for our guest today, send them in during the show so that we can answer, or the guest can answer them for you. Before we start, I'd like to say belated happy birthday to Tata. It was her birthday yesterday. She turned 90, and she's watching the show. Hello, Tata, I love you. I'd like to say hello to my mom who's watching the show. Mommy, I love you. You are mommy, my love. Okay, and I'd also like to say hello to those watching in Hong Kong. I won't name all of you. To those watching in Honolulu and in Madrid, thanks for joining us today. And for those watching in Metro Manila, of course, a good afternoon to all of you. Today, we're going to talk about ocular genetics, and we have Dr. 𝗛𝗵𝗵𝗶𝗵, whose specialty is ocular genetics. So let's start off the show and dive right into it. Good afternoon, Dr. Ibanez. How are you today?
I'm good. Good afternoon. How are you, Nicole?
I'm okay. I'm okay today. The heat is here in Metro Manila is a bit searing, but you know, we're okay. We're okay. We're surviving it. Doctor, okay, what is ocular genetics? I'm sure that's the first question that everyone has in mind, as I do.
Okay. So actually, ocular genetics is a subspecialty in ophthalmology, no? So it focuses on inherited eye diseases. So these are diseases of the eye due to genetic mutations or changes in the DNA na namamana, no? So it causes disease of the eye na pwedeng mamana. So it's actually a new field. It's a growing field. I think there's around about mga 80 siguro worldwide who specialize in this field, no? So it's fairly new.
And you're one of them. Out of the 80 in the whole world, you are one of those specialists. Okay. So basically you were an ophthalmologist first, or you are one. Right. Once you're one, you cannot undo that. You studied for that and been accredited, but you've become a specialist in ocular genetics. And as you said, yung mga disease na namamana. So diseases of the eye or conditions that are inherited. So, okay, doctor, as an ocular geneticist, do you only treat people with cases that have to do with your specialty or this new specialty, or like how are patients usually referred to you? Do you still, take care of other cases?
Oh yes, no. I'm still an ophthalmologist. So actually, I still look at general cases in ophthalmology, and I also subspecialize in pediatric ophthalmology. So I still see kids, but I now see people with inherited eye diseases also. No, so they get referred to me by other ophthalmologists as well.
Okay, so how it works is that, of course, if other ophthalmologists notice something and it's better treated by you, it can be better treated by you, and it's an inherited eye condition or disease, they refer them to you. But also, you also find, maybe when you treat patients, like as an ophthalmologist, you find out that they do have genetic eye diseases.
Yeah.
Is that how it works? It's like biglang, oh, you have one, surprise.
Sometimes, no, usually they get referred, no, because nakikita na sila ng ibang ophthalmologists, no. But sometimes I do see na pagdating nila sa akin, biglang inherited eye disease pala. But the majority is really referrals, no. So they really come from other ophthalmologists.
But it's lucky for people that, okay, the referrals come from other ophthalmologists, but also the ones who have been seeing you for their eye checkups. At least nakikita mo agad din, katulad ng ibang ophthalmologists. Okay, thank you, doctor. Now, what are the most common genetic eye diseases? Perhaps you can give us some examples, and maybe from what you've seen in your practice here in 𝗛𝗏𝗵𝗹 and in the Philippines.
Okay. So, ocular genetic disorders, no, or these eye diseases can affect all parts of the eye, no, from the front, no, yung the cornea, to the back, no, to the retina. So these diseases themselves are considered rare, no, and we say that a disease is rare when it's around 1 in 2,000. Pero yung mga common genetic eye disorders include retinal dystrophies, meaning mga disease sa retina, no, like retinitis pigmentosa, no. It's a disease where our peripheral vision and our vision at night are affected first, no? So dahan-dahan nawawala, nagde-degenerate, no? On the
Mhm.
other side of the spectrum is some macular dystrophies, no? So instead of the periphery getting degenerating, it's the central vision that gets lost first, no? And
Okay.
actually, some common diseases also, Ma'am Nicole, no? Yung cataract, no? Actually, one-third of cataracts can be genetic, no?
Yes, I
So,
heard that
mm-mm.
before. So it's true. Cataract, a very common thing that people get. It can be a genetic disease, but can it also be like just you just get cataracts? It doesn't
Yes.
have to be genetic.
No? Actually, cataract, no, it's a natural process, no? So,
Mhm.
everyone who's aging, no, really gets it, no? Usually by around 50, 60, no, nagde-develop na siya, no? But those that are genetic usually start at a younger age, no? And usually, they're bilateral already. Dalawang mata na kaagad,
Dalawang
no?
mata. Yeah, because with
Mm-mm.
cataracts, doctor, no, it can be one eye first, and then the
Yes,
other one is a nose. But you would know, I guess one of the tells for you that it's genetic is that if it starts earlier on,
yes.
not between 50 to 60, and then both eyes are starting to develop maybe the same type of,
Y-
the same, parang it's covering the eyes at the same speed or
Mm,
speed, but
yes. You know, a sign that it is genetic, Ma'am Nicole, is that if two eyes are affected.
two eyes are affected.
Mm-mm.
Okay, yes. If it's only one eye, it may be just something that
Y-
you got, but I mean you develop on your own, or because of the environmental factors or whatever it is.
yeah.
But if both eyes are getting affected at the same time, then it's a sign that it's genetic. Okay,
Yes.
so doctor, you mentioned like when you say a rare disease that has to do with the retina and the cornea, that's 1 in 2,000. So yeah,
Mm-mm.
that's pretty rare. But you've treated people who have these rare diseases. You've seen
Yes.
them. Okay. Are there a
Mm-mm.
lot? Like, is there a certain demographic for the rare diseases and for the like more common genetic disorders?
No, actually, being a rare disease, no, yung mga diseases na ganito, there's not really a lot, no? And there are, different kinds of genetic eye diseases also, no? So it's a whole spectrum, no? So pag if you take them individually, no, they're very, very rare, no? You don't see them a lot, sometimes once a month lang, no? Or even twice a month, no? Makakakita ka ng ganito, no? So, but if you put them together, no?
Mm-hmm.
Maraming apektado talaga with genetic eye diseases pag pinagsama mo na silang lahat, no?
Doctor, the front part, just before we go into uh asking you how, describing how one can inherit a genetic eye disease or diseases, kasi pwedeng hindi isa lang, pwedeng dalawa, di ba?
Mm,
Na inherit. The front part of our eyes, okay, you said is the cornea. Is
the
that
cornea.
the round part?
Yes.
Okay, and then inside, and then the retina is behind that. We don't usually see that, no?
Yes.
When we look into someone's eyes and fall in love, we don't usually
No.
see it. Okay, but it's there. It's part of it, and then I guess all the other mechanisms that allow our eyes to operate the way they're supposed to, and okay, like there's stuff like macular degeneration. Is that inherited? No.
Yes.
Yes.
We can classify these genetic diseases into two, no? The first one is if it's purely genetic, no?
Yes.
So, meaning, yung gene lang talaga may problema, Ma'am Nicole, no? Now, the other kind of disease is it's genetic, but it also has an environmental factor, no? So, one example with what you mentioned, no? Yung age-related macular degeneration, no? It's genetic, and at the same time, may environmental factors also, no? Another example I could think of is yung glasses, no? As simple as glasses, no? So it's genetic. If you have one parent or two parents who wear glasses, no, most likely the odds are you will wear glasses also. But at the
Yes.
same time, there are also environmental factors, no,
Yes.
behind it, no?
Okay, so yeah, since we've gotten into that, the parents, most if one of your parents is wearing glasses, most likely you will wear glasses. Can you tell us uh you know how does how is the genetic eye disease inherited within the family? Okay,
Oh,
so the
okay. So
parents to the children or the grandparents, whatever's involved with
okay.
the
So again, no, genetic diseases, no, they are caused by mutations or changes in our genes, no. So I have to discuss the genes first, no, before
Sure, no problem. No
before
problem. Go ahead.
so that you guys can understand, no. So we have around 20,000 genes in the body, no. So yung each gene na yon, Ma'am Nicole, has a certain function or controls a process in our body, no. So for example, no, there's a gene that will determine if we will grow tall, no, or if we will
Mhm.
grow short. There's a gene for eye color, no, yung mga ganyan, no. So in inherited eye diseases, there's a gene that is responsible, for example, how we see, or the
Mhm.
gene that controls the growth of the eye, no. Now remember, each gene na yon, we will always have two copies, no.
Yes. One
One
from the
copy
father.
from the mom and
Mhm.
one from the dad, no. So that's how we inherit it, no.
And then, doctor, when it comes to the genes, it really is a mutation that occurs over time within a family. And is that correct? I mean, please jump in and correct me anytime. So I want to know if I'm understanding this correctly.
Yes.
Yes.
So a genetic mutation means that there's a sequence change or there's a change in the gene, no? So remember, Ma'am Nicole, we're made up of DNA, no?
Yeah.
So yung DNA na yan, actually letters yan, no? I'll try to make it simple. Letters yan. So
Sure.
ATGs, ano yan, combination of letters lang tayo actually, no? Of
Yes.
nucleotides, ATGC, no? So that's adenine, thymine, glycine, ganyan, no? So in
Yes.
genetic mutations, nag-change yung sequence, no?
Okay. So that's
Mm.
what happens with, see, that's such a revelation. Kasi
Mm.
we just hear mutations. We understand mutations means it mutated. We get that. But we're made up of DNA, and when there's a mutation in a gene, the sequence na dapat it should be ATGC,
Parang ganun.
sequence changes. Okay,
Was
yeah,
changed.
that's
Parang nagka-wrong
yes.
spelling na,
Wrong
no?
spelling. Okay,
Oo,
wrong
oo.
spelling, wrong. Pass your
Oo.
papers, wrong
Yes.
spelling, wrong. Okay. Okay, that's a great way of putting it to us, and it's simple enough that we can understand, because we
Mm.
also want to understand how did this happen and not just take it for granted that, oh well, it's genetics, it's
Mm.
mutation. That's great, doctor. So, I mean, that's a great explanation. So, as you said, we have two copies of one from our father, one from our mother. And are genetic disorders, like, are they how do you say this in when it comes to doing the genes? Are they, oh my gosh, I forgot the term, the one that's prominent and the one that's
Is
how
it
do
the inheritance?
recessive gene? I
Yes,
mean,
the autosomal
okay,
dominant,
dominant
autosomal
and
recessive. Yes, yes.
recessive.
So,
Thank you, grade school and high school, for making.
yes.
Okay,
Yes.
so there are dominant genes and recessive genes.
Yes.
Are genetic mutations like recessive or dominant, or can they be both?
Yes. So there are lots of mutations or inheritance pattern, no. So tama ka, Ma'am Nicole, no. So the first one is autosomal dominant, no. So if the disease is autosomal dominant, di ba, remember we always have two copies, no?
Yes, two
In
copies.
autosomal dominant diseases, only one copy is needed to be mutated to
Okay,
manifest the disease,
all right,
no? But in autosomal recessive disease, the two copies need to be mutated, no? For you to manifest the disease, no?
all right.
So, yun, no? Kaya important yung concept na two copies, no?
Copies. Yes, because I mean, some people will say, how come, let's say, okay, my sibling got it, I didn't, right?
Mm.
So, okay, that's why I'm getting into this family thing. And sorry for nagging you, pressing this part of
No.
the conversation. But I think a lot of people might be, asking this, because I'm just one of those people who's a non-medical professional who has these questions, and we get to think of it. Can a person have more than one inherited genetic eye disorder? Like, for example, let's say I'm, my two parents, they have like one parent has a certain genetic, a gene that's mutated, and then let's say that's the mother, then the father has another one. Can a person inherit both?
Yes, of course, no, Ma'am Nicole, no. So, people can have two kinds of genetic eye diseases, no.
Mhm.
So, in my practice, no, I've seen quite a few, no, that they have a mutation in the medyo deep na, pero in one gene that controls the growth of the eye, no. So, maliit yung mata nila, no. At the same time, they have another mutation, no, that causes them to have a retinal dystrophy, no, something like that. So, dalawa na kaagad yung sakit niya, no. But regarding, kasi you mentioned the siblings also, no, if they will
Yes,
get
yes.
affected, no. I want everyone to understand also that even if you have the mutation, no,
Mhm.
even if it is something that is disease causing, it doesn't necessarily mean you will develop the disease, no? A
Okay.
lot of factors still come into play, no? So, in genetics, we call it penetrance, no? So, hindi ibig sabihin na may mutation ka na, you will get the disease. No?
Yes. Yeah, that's good to know, doctor.
Mm-mm.
Because some worry that, oh, all of us are gonna, and some also question, how come I didn't get it?
Mm-mm.
You know, my sibling got it, or it could be even from the grandparents, right, doctor? Like your
Yeah.
cousin or your
Mm-mm.
aunt or whatever could have it, and then you
Mm-mm.
also have it. That's why, like in our culture, we always say, mahilig, nagmana kasi yan sa ano yan. Ay, minana yan sa tito niya. Ay, minana yan. You know, you'll see like two parents. Okay, is it possible? Like two parents do not, let's say they have 20/20 vision. Can
Mm-mm.
they have a child that has, that doesn't have 20/20 vision and it's genetic? Because
Yes.
let's say their
Mm-mm.
grandparent, yes, it's possible.
Yes, it's possible, no?
It's
So,
possible, okay.
oo. Actually,
Yeah,
Ma'am Nicole, in autosomal recessive disease, no? So the parents usually do not have the disease because they are only carriers, no?
carriers, okay.
So the child, no, nakuha niya yung dalawang copies from the parents, the one copy from each of them that are mutated. So
Mhm.
magma-manifest siya ng disease, no? 25%, no?
25%. Okay.
No?
Then,
So, yun.
sorry, go ahead. Sorry, go ahet, doctor.
No, no, no. It's
Dami yung question. I'm so excited
no,
about
no.
and
I'm
talking to
excited
you.
also.
And let's say there are two parents who have the disease and somehow, I mean, okay, let's just get the most like striking example. Let's say we have two parents who are blind. Can they have a
Mm.
child who's not blind?
Ah,
Because
it,
people just,
yes, pwede din, no? Yun nga eh, even if you have the mutation, no, pwedeng hindi mo mag-manifest ng disease, no? And it depends also on the kind of disease, no? So, again,
yeah,
no, we have autosomal recessive, we have autosomal dominant, we have other kinds of inheritance as well, no? Parang mitochondrial madami, no? And
um,
each of these kinds of patterns also have a certain percentage kung paano namamana, no?
okay.
So, for example, in autosomal dominant disease, since there's only one copy that is needed to manifest the disease, usually malakas yung pagmana, no? You see it in every generation, no? Usually, no? Not all the time, no? And the risk is usually 50% per pregnancy, no?
Okay.
As
Okay.
opposed to autosomal recessive, since you need two copies,
Okay.
25% risk, no? Yung pwede magkaroon yung mga offspring. So, nag-iiba-iba din, no? Oo.
Pag dominant gene, may
50%.
talaga 50% na mamamana. Pag
More
recessive
or
gene,
less. Per pregnancy. Per pregnancy.
pregnancies, when it's a recessive gene, 25% risk.
Per pregnancy.
Yeah. Ganon din ba yung mga kagandahan pag dominant? Dalawa
Sana,
lang.
oo.
Oo.
I
Okay.
think they're dominant, no? Every generation meron.
Ay, nako. Okay. Well, we should talk more about. I love this topic, and because a lot of people, I hope it reaches the people that need.
Yeah. Hello?
Chit Chat with Double V with host Vivian Velez is a program that breaks down important national concerns, events, and stories, featuring newsmaker interviews and compelling features to add context, clarity, and answer the questions on your mind. Every Sundays from 5 p.m. to 6:30 p.m. on Radio Bandito TV,
Channel 224 Sky Cable, TV Plus boxes, GMA Affordable Box, Easy Box, and all DTT boxes. Simulcast on DZRJ 8:10 a.m. Seen on Facebook/DZRJ 8:10 a.m. and YouTube channel DZRJ 8:10 a.m. Radio Bandido.
Magandang araw po.
Sa Mindanao, ako si Jude at your service.
Samahan niyo po ako sa mga kwentuhang lokala, turismo, at usapang serbisyo ng buhay at kabuhayan, kalusugan at kalikasan, kultura, sining at kasaysayan dito sa Bayan ni Juan. Sa bayang mapapakinggan at mapapanood sa DZRJ 8:10 a.m. ang Radyo Bandido sa Metro Manila. DZRJ Radyo Bandido TV, available sa Sky Cable Channel 224 at sa mga digital box ng GMA Affordable Box, ABS-CBN TV Plus Box, sulit TV box ng TV5, live sa Facebook, www.facebook.com/DZRJ 8:10 a.m. at DZRJ 8:10 a.m. Radyo Bandido sa YouTube channel tuwing araw ng linggo, alas 3 hanggang alas 4 ng hapon dito sa Bayan ni Juan.
Okay, guys, welcome back to Healthline with 𝗶𝗶𝗵𝗹𝗶, or I'm actually welcoming myself back. I thought the doctor got cut off, but it was me. Okay, I'd like to thank the person who refreshed the internet, forgetting that I had a show at this moment. But anyway, those things happen. Doctor, let's get back on topic. So, you were talking about how inherited genetic diseases are, well, inherited ocular genetics is always about the genes, and how it's always important to remember there are two copies, one from each parent, and that if it's a dominant gene, there's a 50% chance that it will manifest. And if it's a recessive gene, there's a 25% chance it will manifest. So, as you were saying, doctor, and I think it's important to hammer in on that, if you happen to have these genes that you inherited, it doesn't always mean that you will get the disease or condition. Okay. Yes. Thank you, doctor. Okay. So, doctor, is there any demographic? I mean, we're talking about science, so sometimes, it comes into play that they have seen more cases of genetic eye diseases occur. I mean, sometimes they will say it's it's people from a certain part of the world or a certain race. That's just science. We can't argue with it. Is there any demographic that you see or you have seen or studied like that fits into that, like that, where you would have to expect more, or you could expect more inherited genetic diseases?
Okay. So, usually, in the Philippines, not so much, but in other races, kasi they have what you call consanguinity, So it means that sometimes, two relatives, are married, and they are related also to each other, So that increases the risk for genetic eye diseases, especially autosomal recessive ones, Tapos we also see in some like Jewish people, or some people of European descent, they tend to have retinitis pigmentosa, for example, are more common, in those races, So meron talaga, sa Philippines kasi, Ma'am Nicole, hindi pa siya na-explore because it's still so new,
Yeah.
Oo. So right now, at least for the eye, I don't find, hindi pa ako nakakakita ng yung mas madalas sa Pilipino,
Okay, that's great to hear for Filipinos. You should check out my whole family, though, because we like marrying each other. Okay. Some of the members of my family will kill me for that. We also like separating each other, whatever, doc, Okay. Okay, so doctor, who are at risk for genetic eye diseases? Like, would you say that there's who might have a higher chance of inheriting eye diseases among the population, or just generally speaking when it comes to,
Okay, so yung people who are at risk for genetic eye diseases, no, are of course those who have a family history, no. So, ibig sabihin, if you have a parent sibling with the disease, you may develop the disease as well, no, if it's genetic, no. And as I mentioned kanina, no, there are certain, ethnic groups, no, that have a higher chance of some genetic eye disease, no.
Yes.
So, yung nga, yung mga Jewish, no, actually the Arab nations also, kasi I think they practice consanguinity, no.
Yes.
I remember in my training abroad, no, sila usually yung may autosomal recessive disease, no. And
Yeah.
remember, no, I mentioned also that the disease can be classified, no, into a genetic eye disease na meron din environmental factors involved, no. So,
Yes. Yes.
environmental factors can also increase your chance to develop, no, or worsen your genetic eye disease, no. Like smoking, no, very bad yun, Ma'am Nicole, no, because if you have a genetic eye disease or retinal dystrophy, no, in particular, no, mas mabilis mawawala yung vision mo kahit ma-expose ka lang,
How
no,
come?
to
How come?
secondhand smoking, no.
Why is
So,
that? Why with the retinal dystrophy is smoking bad?
No, because the cigarette smoke kills the what we call photoreceptors, no, in the
You
eye.
mean when it hits your eyes, ganon?
Yes, no. So
Okay.
it kills the photoreceptors, no. For us without genetic mutations, no, okay lang, no. Baka mas mabagal yung pag-degenerate even if we're exposed to smoking. But for them kasi, konti na lang and weak pa, no,
Okay.
madaling mawala, no. So mas
Okay.
madalis silang nabubulag.
Okay. So, okay, when you're talking about those who practice consanguinity, would it be maybe the Ashkenazi Jews
Yes.
the Jew Ashkenazi Jews, they have a lot of
Actually, not really consanguinity also with them, no? My professor kasi was Jewish, no? The one who taught me ocular genetics, no?
yes.
Something happened also, no? Yung during the war, no? So,
Yes.
parang naubos sila.
So they
No?
had
So,
to
lumiit yung population, no? So, minsan, yung mutation, since the population is so small, umikot na sa kanila.
Yes. I mean, the Holocaust, and they married each other to, to keep their race and their culture alive. So there were fewer people to choose from to marry. Sounds like how it is here. No, I'm just, even if we didn't, okay. Okay, so doctor, what are the signs and symptoms that someone might have a genetic eye disease? Like, let's say you're checking out someone, or maybe someone feels like look, I'm wearing glasses. Like, what are the signs and symptoms that something happening in my eyes is genetic?
Okay. So, it varies a lot, no? Kasi it's so broad yung genetic
Yes.
eye diseases, no? But generally though, no, yung minention ko kanina, usually they're bilateral, meaning both eyes are affected, no? And that symptoms may start at a younger age, no? Although, meron din nagmamanifest later in life, no? And of course, no, Ma'am Nicole, since it's the eyes that are involved, no, the usual signs or symptoms of genetic eye disease, no, is loss or blurring of vision pa din, no? Yung lumalabo yung paningin, no? Depending on the eye disease, no? Pero in particular for people with genetic eye disease, especially for retinal dystrophy, no? Yung panlalabo ng paningin nila, they usually describe it as nahihirapan sila sa dilim. Pwede yun, no? We call that 𝗛𝗏𝗶𝗶. So parang nahihirapan sila pag pumapasok sa loob ng cinemas kasi madilim, no? Or the parents can notice sometimes that yung anak nila parating gusto yung night light nakabukas.
Yes.
No? Oo. Or on the other side, no, yung iba naman madaling masilaw, no? We call it photophobia, no? And of course, no, yung iba may problem sa color vision, no? Tapos some other things, ang dami kasi, no, yung iba eye misalignment, strabismus, no, can also happen in genetic eye disease, no? Actually, no, Ma'am Nicole, these symptoms are also symptoms of other kinds of eye diseases,
Yes,
not
but
just genetic. But what's important finally is that if they run in the family, that's a very high chance that it's genetic, no? Kunwari, yung nanay nahihirapan sa dilim, tapos biglang yung anak, you might have to investigate them for retinitis pigmentosa. No?
What do you think of scratches on the retina that nobody knows how they got there? An example lang. Is that something that could have just happened environmentally, or
yes, or pwedeng environmental lang din yon, Ma'am Nicole, no, yung pag-scratch sa retina, parang kumbaga parang nabutas ba or na-detach,
parang may
no?
scarring, ganon.
Yes,
Tapos,
it can still be something spontaneous, no, not genetic, no.
Okay. Pero it's on the back of the eye, di ba? So, like, we really have to take care of our eyes. We take it for granted for those of us who can see, you know. So, doctor, okay. Are there genetic tests available to determine, like, the risk of developing a certain eye condition, or, you know, any kind of to diagnose genetic eye disorders? And are they available in your practice or in Makati Med? Like, and when should someone start doing genetic testing? Okay, let's go first to are there genetic tests available?
Yes, there are, no. We have different kinds of genetic tests available already, no. Not just for genetic eye diseases, ha. So, disclaimer, no, I'm an expert in inherited eye diseases, no, pero not in other kinds of genetics, no. But we have different kinds of genetic tests already, no. Usually blood or saliva samples yung ginagamit namin, no, Ma'am Nicole, no. Actually, in the Philippines, we have, no, Ma'am Nicole, no, we have the Philippine Genome Center, no. So other providers may look into that, no, if they find it warranted to test the patient, no. Personally, though, no, for the eyes at least, no, I still send my samples abroad, no, because mas ano siya, they have pre-made tests already for the eye, no. I haven't checked yet with the Philippine Genome Center, no, pero yung sa akin now, I still send abroad, but we have available already. No,
well, you trained abroad and you're more comfortable with that. As you said, they have pre-made tests already, so it would be easier and faster for you in your practice. That's your choice naman, and also your, you know, your patient's choice to trust you with that. And thank you for giving us information that there is a Philippine Genome Center, and perhaps others who want to test there, you know, can do that or talk to them. So it's usually blood or saliva samples. What kind of blood test would it be? Like fasting, no fasting, that kind of thing? No?
Normal blood test lang, Ma'am Nicole. You just get
what kind? What kind?
The usual blood test, Ma'am Nicole, yung when you get blood test for CBC, like that, pero mas konti minsan, no? 3 cc.
Kasi you're looking for something really specific lang and you're gonna send a sample. For saliva, how do you do that? Let's describe the process so that, you know, so people know na it's not that big a deal to get tested. I mean, the process of going through it, kasi a lot of us, you know, we feel like, I have to do this, like it's an exhausting process. So at least you can tell us how easy it is actually, or how simple.
Oh, it's very easy, no? So for the saliva, no, I usually get a kit, no, from the lab, no, and test tube lang yon, Ma'am Nicole, no, and ang gagawin mo lang is dudura ka hanggang mapuno mo yung certain level, no? And
are we allowed to drink water? Para
you don't even we advise against eating, no, siguro a few hours before getting the sample, no? Pero usually you just spit on the tube, no, until you reach a certain level, no. Now for those people na you needs assistance or hindi makadura, no, like babies, no, or children, we use what we call buccal samples, no. So parang may cotton tip lang yon, Miss Nicole, no, tapos iikot mo lang sa gilagid.
Yes, ayan. Doctor, stop calling me Miss Nicole. I'm just Nicole, and you're doctor. You're Dr. Ibanez.
But I have to add, no, Ma'am Nicole, no, actually the Philippine Genome Center is very good, no. It's at par, no, with the rest of the world, no. Yung sa testing nila, no? I know the machines that they use, they're at the same, it's the same already, no, in the West, no. Ang sa akin lang is wala silang ano, yung as of now, no, I don't think they have eye panels. I'll check again.
Okay.
No? But, so that's why I send abroad, no.
Yes. And then when you send it for testing in the labs, how long does it usually take for to get the results, to see if it's positive or negative?
If coming from here, and I usually send to the US, no, to San Francisco, it would take 4 days to get there, and once the lab gets the samples, usually 4 to 6 weeks.
4 to 6
That's what
weeks.
I tell them. But sometimes the lab releases earlier.
Yes.
Or maybe late. Minsan mas late naman, no? It depends, no?
So you have about a month or two, you know, more or less, and that's being like just, you know, being conservative and rounding it up. to know whether you are negative or positive.
Mm.
And in the meantime, does the patient have to do follow-up things with you, or they just have to wait until you call them and say, here are
No,
your
they wait lang, Nicole,
Mm,
no? But I
mm-mm.
have to add, no, yung genetic testing, no, you just can't order it, no? The
Yes.
patients need to undergo genetic counseling, no?
Okay,
So
yes. Let's
bef
talk about that,
oo.
doctor. What is genetic counseling?
So genetic counseling is you counsel the patient, no, regarding what they may have, no, and the benefits and risks of genetic testing, no.
Yes.
So may benefits and risks pa din talaga siya, no.
Yes.
So because the patients need to understand why they are getting tested, no. So
Okay.
that's very important, no. So counseling also offers support groups, no, for kasi remember these are people with rare diseases, no. So
Yes.
they the genetic counselors usually know no kung kanino sila pwedeng ilapit para may support din sila, no, things like that, no.
So,
So it's
doctor,
very important.
let's say you suspect that a patient has a genetic disorder or more, one or two or more, or just one. And one is enough to
Mm.
you know, to hurt somebody. I mean, one is enough. We don't want any more than that. Are you part of the team that counsels, and you mentioned genetic counselors, or do you work with a team? How does it happen? And then I'm happy to hear that you mentioned like there are groups. So is there kind of a thing like group therapy or group support with other
Mm.
patients who may have the same disease?
So the ideal team would be an ocular geneticist with a genetic counselor, no. So genetic counselors are really very important, no.
Yes.
Right now, no, I do the counseling myself, no, at
Mhm.
least for the eye, no,
Yeah.
because that's my expertise, no. But ideally, there should be a genetic counselor with you. Kasi, Ma'am Nicole, no, Nicole, no,
Yeah.
the counseling itself takes very long, no. It's
Yeah.
actually siguro an hour, no. It takes too much of your chair time, no. Kaya lang kasi medyo konti lang din ang genetic counselors in the Philippines. I don't have the exact number, no, but
Yes.
they're not that many also, no. So for me, no, so that the patient don't have to go outside, no, para
Yes.
isa lang yung pupuntahan nila, no. Ako na yung gumagawa at least for the eye, no. Pero
Oh.
I hope no that we get some
Get more
counselors soon.
genetic. How do you become a genetic counselor? I'll ask you that after the show. Okay.
We're one of the few countries in Asia na merong program for genetic counselors. And I think
Really?
I'm very proud of that, no? In UP, I think, no?
That
Oo.
too.
The
Yeah.
trained genetic counselors, no? Mm.
Yes. That's good. Yeah. I'm proud of that as well. And
Oo.
that's great. We do need that. And doctor, do you ever like work with like let's say therapists or psychiatrists, because the patient is so burdened by, the no not I mean the possibility of having this genetic disorder and it manifesting.
Mm-mm. Again, no, that's the ideal setting, no? Usually, no, when I trained abroad, no, there,
Mhm.
meron talagang on board na psychiatrist, no, like that, no. Here, I always offer to the patient, no, that if they want to talk to the psychiatrist, no, I do the one offering. Pero sa abroad, ano na sila, seamless na
Yan
sila
na,
dun eh.
sa whole team
Oo,
na.
parang they're a whole team already. Here, I just refer when needed, no, when the patients want to be referred, no. Kasi
Yes.
remember, there's a stigma also pag
Yes,
nire-refer
I was
sila.
gonna say that there's a
Oo,
stigma, and we
oo,
should like get over that, take out the stigma, because
oo.
I mean, if we need it and we just need to talk, when we need to talk, we need to understand things, no?
Mm-mm.
So yes, okay, some will not even want, or it doesn't occur to them, but reminding patients and non-medical professionals out there like myself, reminding the audience, if you need it and you can afford it, do it. I mean, thinking of all these things and peace of mind and your mental health is just as important as dealing with your physical health, because it also intertwines a lot. Doctor, you mentioned that the counseling takes long, even before getting even before conducting the genetic testing.
Yes. So
Um,
there are phases in genetic counseling, no? The first one is what we call pre-test counseling. Before you get the genetic test, the patients need to understand the genetic test, the risks, the benefits, no? The disease, no? Tapos after you get the results, no, there's post-test counseling where the tests are interpreted to them, no? And the implications, no, kung ano na yung mga kailangan gawin na ibang diagnostics if needed, no? And of course, the support groups, no, kung meron, no? We refer them to those support groups, no? And then post-test counseling also involves yung if there are any treatment, no, for the disease that they have, no? So all those things, so pre-test and post-test, no?
Doctor, you mentioned you mentioned it twice, actually, I think maybe 2 or 3 times, the risks and benefits. What are the risks and benefits then when it comes to genetic testing even has a risk?
Yes, oo.
Can you tell us about that?
Okay, sige. So maybe to be I'll start with the benefits first, no?
Sure,
Then
yes.
I'll go to the risks, no? So for the benefits of genetic testing, no, of course, no, one benefit, no, is alam na ng patient and the family yung sakit nila, no? It's not unknown anymore, no? So it relieves the anxiety for the patient and the family, no? And that's a big thing, I believe, no? So saka because they know the mutation or the disease already, no? They can make informed choices already regarding their treatment, no? So ibig sabihin, baka hindi na kailangan tong ibang test. Kunwari, baka MRI pwede nang hindi na gawin, no? Something like that, no? Second, no, another benefit of genetic testing is once you know the disease, no, at least, or the gene, at least for the eye, no, we can more or less counsel the patient on the prognosis of the disease, no? Ibig sabihin, per gene kasi, Nicole, kunwari, for vision loss, no, certain genes, mas mabilis yung pagkawala ng vision, no? So kung alam mo na yung gene, alam mo na kung gaano kabilis or gaano kabagal mawawala yung vision, no? And then some genes may associated na pwedeng maapektuhan other parts of the body, no? So pwede na natin ma-watch out for yun sa family, no? And the third benefit is alam na natin yung uri ng pagmana, no? The percentage of kung magkakaroon ba yung offspring or hindi. Not definite, but we have an inkling already because of the result, no? And the last one, of course, is, I think this is what gives hope to the patient, no? Yung gene therapy, no? Kasi a prerequisite for gene therapy is to know the gene, no? Kasi dapat mata-target yung gene na yon, no? So we need to know the gene in order for you to be eligible, if any, no, for any kind of clinical trials for genetic testing. Now, for the risks, no, yung risk for genetic testing, meron din actually, no, yung, di ba I said na the genetic test, no, may, what do you call this, may relieve, no, the patient and the family, no, mawawala yung anxiety. But it may also
create anxiety. Hello? Hi, AJ.
Yung parang since nalaman nilang may genetic... Ay, hello?
So parang it might create anxiety also. It could go both ways. That's the first risk. Okay. And
so,
then
tapos, sometimes, no, the outcomes kasi, it doesn't really happen here yet, no, kasi it's so new in the Philippines, you know, but abroad, no, once people find out that you have a genetic disease, no, you tend to get discriminated by... hindi ka na nakukuha ng jobs, no, or insurance, no, na deny ka na minsan abroad, no. And remember, even if you have the mutation, it doesn't mean that you will develop the disease. So
yes, but they will still look at it and maybe ask you questions. So that is one of the risks. Yes.
So that's another risk of genetic testing, of course, no? Kaya, you know, Nicole, no?
Doctor, are they entitled to look at it? I mean, the genetic, isn't that private information for patients?
No, abroad, no? Here kasi wala pa tayong rules talaga, no? It's in infancy, no? Pero yung abroad kasi, at least where I trained, no? Sometimes they have to disclose, no? So, but there are other states that do not, no? But minsan nalalaman eh. Especially that yung sa insurance, they pay for the genetic testing abroad kasi. So, So they
Ayun,
tend to find
state
out
of New
also,
York.
no? Oh,
But in other states, they don't. Okay.
mm.
I'm like trying to spy, like, maybe your state was New York. No. Okay.
Hindi.
Okay.
Kaya
So,
actually, Nicole, no, if I may add, no, sorry, medyo
yes, oo.
no, if I may add, kaya yung sometimes we don't test in the eye, no, we don't test patients who are asymptomatic, no, sometimes, no.
Yeah, if they, yeah.
Mm.
If maybe you know that you can tell that they inherited it, but it might not manifest, you
Mm.
make a decision or they make a decision. Let's not test it because your information is out there. That's the problem with this world. Our information is
Correct.
out
Oo.
everywhere. They're using it
Mm.
against us and not for us.
Mm.
I go again, George Orwell, 1990. Okay. Um, okay. What are the other risks also? Basically, those are the risks, or there's another set of risks as well. Are there any other risks to
Yun,
get?
the strongest ones are really consanguinity, for environmental, no, yung mga smoking, no, kasi it changes your DNA, no, nagkakaroon ng damage, no,
Hmm?
smoking, oo, um, in eye diseases, no, I ask my patients also, no, to wear sunglasses, no, kasi
Okay.
in retinal dystrophies in particular, no, kasi the UV, no, tend to damage the remaining photoreceptors, no? So, pinapa-shades ko na din sila, no? But
Okay.
ang pinakamalakas talaga smoking, I really tell them to stop, no? And hindi naman siya beneficial lang sa eye, sa lahat naman. Sa buong katawan, no? So, just stop smoking.
Okay. Okay, yeah, that is a goal this year
Oo.
and it shall be achieved, yes. Okay, doctor. So just to recap a bit, the benefits are of genetic testing are one, you will know what you have or if you have it. And that relieves a lot of anxiety for the patient and the family members also. And basically, two, if you know what you have, you'll know how to treat it or manage it, and you'll know the timeline maybe of when this will occur, when that will occur, so that you can take steps ahead to prepare for it, not just as an individual, but as a family, you
Mm-mm.
know, or as with your partners or friends. So, you know, family is what you make it in life. And of course, here in the Philippines, we tend to have more of a community, you know, everyone is involved in more involved in others' lives, sometimes too much. But you know how it you know what I mean. So
Yes,
okay. And then you can also like start planning, like even down to the financially, I have to do this, or maybe I have to change my lifestyle, or maybe I should look for another job, you know. And then also, if you know what you have, you can treat it. You can target
gene.
that treatment, and you can also find out if you're eligible for genetic there what you were saying earlier, this genetic
Gene therapy.
gene therapy. Okay,
Uh,
how would who's basically just you know, even if it's broad strokes, who's who is eligible for gene therapy? Is it individualized talaga or
yes. Oh, it's
okay?
we have to know the gene, no? Kasi yun yung tina-target, no? To be honest, Nicole, no, wala pa masyadong treatment for inherited eye diseases except for one, no?
What is
And that um it came out in 2018, and it's actually the first FDA approved gene therapy in the world, no? And it's for an inherited eye disorder, no? But it only targets one gene, no? So it's RP65, the gene, no? So it targets that retinal dystrophy. But the point of that is kailangan alam natin yung gene
yeah.
involved, no? And there's numerous clinical trials already, no? And na at for the eye, no, madami na per gene, no, na tinitignan kung kaya i-target, no? So I think for this set of patients, no, we should remain hopeful, no?
Yes.
Oo.
And for example, doctor, like if the gene therapy is not being done here, there's clinical trials. I mean, I mean, is it possible to conduct you know, a clinical, parang the patient is in Manila participating in that clinical trial, or they fly them abroad? Because, you know, clinical trials also, it's in the interest, I mean, of whoever's conducting them to have eligible patients
Yes.
kasi they're trials pa lang, di ba?
Mm-mm.
We've seen enough TV movies to know that.
Yes.
Okay.
Correct.
The
You know,
risks
I
naman.
haven't
Yes.
encountered sa Philippines pa, no,
Uh-huh.
for the eye, no? Pero it should be possible, no? But I think it will be very difficult also as of the moment, no? Because of
Yes.
course, no, it depends on the study if they will fund the patient or the patient has to pay out of pocket, no? Something like that.
Yes, yes.
Oo. So, they have to also fulfill some criteria depending on the study. No?
Yeah.
So, pero I think it should be possible. Basta the first step is to know your gene, no? Because from
Okay.
there, maybe we can find out if you can get enrolled, no? Kasi
Okay.
dito wala naman eh. Sa abroad pa lang yung clinical trials, pero madami. Madami
Yeah.
for the eye, no?
And it is possible, and we're hopeful about it. There may be some of us here who qualify, and it's a hopeful thing to hear that, and to hear that it's happening abroad, to hear that it's happening around the world. Eventually it will reach us also, probably. Or maybe everyone here is on a clinical trial that we don't even know about. Here I go again with my big
Alam mo,
I enjoy talking to you so much.
Nicole, alam mo, I tell my patients actually, no, kasi I'm very optimistic with gene therapy for
Yes.
the eye, no.
Mm.
If they're very young, no, around 10, 15 years old, no, retinal dystrophies, no, at least, no, I tell them that maybe in their lifetime, no, I'm not promising, no, but I think in their lifetime they will be able to maabutan nila yung gene therapy, no, in their
Yeah.
lifetime pag ganun kabata, no? So, tingnan natin, no, kung ano, pero minsan kasi I don't want to give false hopes, no? Pero
Yes, I understand.
technology is very fast, no? Imagine we were able to get vaccines kaagad, di ba?
Yes.
So, even for gene therapy, no, it's already there. It's already happening. It's just the matter of testing, no, and if it's working.
Okay. Okay, doctor. Before we talk more about all these things and ocular genetics and all the information you have to share with us, that's so important. And actually, I'm having such a good time. This is a great show for me. I'm having a good time today, doctor. We just have to take a short break. We'll be right back, folks. Don't go away. Stay tuned to Healthline with 𝗏𝗏𝗶𝗵. I'm your host, Nicole Jacinto. We are here with Dr. Ibanez, and we'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of 𝗏𝗏𝗏𝗏. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗏𝗏𝗏𝗏. Available for outpatient care services, our 𝗏𝗏𝗏𝗏 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗠𝗸𝗁𝗵𝗹 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗠𝗸𝗁𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗠𝗸𝗁𝗵𝗵𝗹.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. I'm grabbing a piece of paper so that I can write down more notes and question our very fun, enlightening, intelligent, and educational Dr. 𝗛𝗶𝗶 here. We're talking about ocular genetics, and our topic is inherited eye diseases. And Dr. 𝗛𝗶𝗶 is one of 80 people, 80 doctors in the world who specializes in this. So we're also very proud to have you here in the Philippines, doctor. And thank you for coming back and taking this knowledge and using it to, to help us here. You probably could have stayed abroad and, all of that stuff, but thank you for coming back. Okay, so doctor, we're talking about testing, genetic testing, and how the risks and benefits. And we did mention environmental factors a lot, no? So are there any preventive measures that individuals with a genetic eye disease may have that they can take to reduce the risk of it manifesting or of it progressing, and becoming something that it's really hard to live with?
So if the genetic disease,
Doctor, your volume, I think maybe your microphone is covered.
how about this one?
Maybe just a bit louder, doc.
Here.
Okay, there. Okay.
So in purely genetic eye diseases, it's very hard to prevent them already, because nasa genes na talaga sila, no? So
Okay.
it's a matter of waiting, for them to manifest or if they will manifest at all. But again, that's why I keep mentioning smoking, because that's the only thing right now, at least for genetic eye diseases that we see, for retinal dystrophies especially, that can hasten the worsening of the disease, no? And
Is
then,
it-
of course, ultraviolet, the sun also.
Okay. So it's smoking and ultra UV rays from the sun. Is it how about lights, normal lights, light fixtures around the house? No.
Okay lang yun.
Okay lang yun. What about light from the TV?
That's okay also.
Okay, so I'm okay with that. Okay. Okay. And then what about, but UV rays, you would ask your patients to wear sunglasses talaga. Okay, I have an excuse to look cool again. Although sometimes, when people wear who let's say they don't have great vision, when they wear sunglasses, it feels like, it gets even darker.
Yes, correct.
So it's not something that they always think about. Including I'll always defer to wearing something that is not. What do you think of those sunglasses? Those glasses that just turn dark when they're exposed to UV rays?
So
Are they
that's
good?
good also, no? Actually, that's better than wala, no? Actually, my patients nahihirapan talaga with the shades,
Yeah.
no? Kasi remember, these are patients with retinitis pigmentosa. So in the dark, hirap na sila. So pag nilagay mo yung salamin, wala na silang makita, no? So
Yes.
I tell them to if kaya nilang may kasama sa labas, no? To wear shades, no?
Yes.
Oo. So, but yung mga ganito din, Nicole, no? I also refer them to what we call low vision specialists.
Okay, there are low
Oo.
vision specialists.
Mm-mm.
Okay. And then doctor, what about people? Well, I've done this a lot. I know people who do it. Let's say they have with someone with retinal that disease that you know that's the gene that you can find, and that's the one that you can actually treat now. I think it's retinal pigmentosa. Is that correct?
Retinitis
Yeah.
pigmentosa. A certain
Okay.
one.
Okay. Do they also have like, since they're having a hard time seeing, do they also have like, do they usually have to wear glasses, or let's say, other aids that help you see, like some might use contact lenses or whatever it is, kasi mataas yung grado nila, like, are they also like that, like they have to do, most of them, like, it's not just about wearing the sunglasses, but they usually wear other kinds of glasses because their grade is high or they have astigmatism and all of that?
That's a very good question, no? And it highlights also the importance of knowing the gene, no? Kasi some genes involved, at least for RP or retinal dystrophy, nakikita namin if yun yung gene na involved, mas mataas yung grado nila compared to other people, no? Or
Okay.
other people with the same disease, kumbaga, no? It
Okay.
depends on the gene, no? Now, regarding yung mga wearing ng contact lenses, wearing of glasses, no? That's why I mentioned low vision specialists, no?
Yeah.
They're ophthalmologists who specialize in giving aid to people with low vision already, no? Not just for genetic eye diseases, no? And they're
Yes.
very knowledgeable in giving, kunwari, magnifying glasses. Alam mo,
Yeah.
the technology for them also is very fast, ha? Madami ng technology that can help you see, no? Hindi ginagamot yung disease but can help you with your activities of daily
Yes.
living, no? So I refer them, auto-referral din ako sa kanila. Once I see someone with a genetic eye disease, part na sila of the team of the referral, no? Low vision specialists, no?
Yes.
Oo.
And doctor, like, what do you think of those glasses that, when you reach a certain age, they say doble vista? Like, two kinds of glasses, to one to see far, and then one to see near, or so like when you're reading or working. What do you think of? Do you think it's better to wear two different kinds of glasses, or, I mean, just an opinion? Because a lot of people must be like looking at their glasses now and
Well,
thinking about it, or the one that they call that, parang I
Progressive.
don't know. It's like, yes, progressive, yes.
So the difference between the two is yung progressive, wala yung linya. Nicole, no? Oo, so some people, kaya nila gusto yon kasi they don't look old, no? But there's a certain kind of adjustment also with that one, no? Double vistas and progressive means that you have two lenses already in the eyeglasses. Tama ka, no? One is for distance and one is for near, no? The
Yes.
reason why we wear near, no, pag tumatanda na tayo, is what we call presbyopia. No, yun yung parang humihina na yung pag-focus ng mata, no, parang nagiging brittle. Hindi na ganun kalakas, no? So, if you need na aids, no, pag nagbabasa, kunwari, Nicole, nilalayo mo na yung book, kunwari, no? Then, ibig sabihin,
Do
baka,
not confirm or deny.
hindi, baka kailangan mo na talaga two lenses, double vista or progressive, no? It's a choice between the two, no? Pero kung kaya mo pa naman magbasa ng malapit, no? Pwedeng isang lens lang, no? Oo, yung for distance lang.
And then, since you recommend sunglasses, doctor, for certain patients, do you, like what I would do before is I'd have my sunglasses, yung grado, I'd change the lenses and put the grade. Is that okay? Is that not okay? I know a lot of people who are asking these, like, very just like everyday questions. Is it okay if I wear sunglasses that have the grade in them, but it's darker because it's a dark glass?
Well, it's definitely gonna be darker, no, with the shades, no? But the reason why we put grade, no, in the eyeglasses is so that we can see clearly, no? So if you put it with the shades, no, syempre mas madilim siya, pero at
Yes.
least, no, you can see clearly also, no?
Yes.
So, kung ganon, okay lang din, no? Oo.
So, okay, and then nobody can just borrow your shades and say, "Oh, mine na lang," because
Oo. Because it's not gonna be the right grade anymore for them,
they're
no?
gonna throw up. They're gonna be like, "Ugh."
Oo.
Seen
Yeah.
that happen. Okay. So doctor, when we've been talking about preventing and it's smoking and UV rays, those are the best things that you can recommend for patients who have genetic disorders and they're waiting for it to, either it's going to manifest or not, either it will progress or not. Do these measures that help prevent? Do they work very well, or is it just delaying the inevitable? I have to ask you that.
That's another good question. No, most of, not all, but most genetic eye disorders are progressive. No? Sabihin, they really worsen with time. No, so the smoking.
Sorry, the microphone, doctor. It just
Oh yeah, there. So
okay.
most of the genetic eye diseases are progressive. No, meaning they
Progress.
really worsen on with time.
Okay.
No, not all, but most of them. No, so when I say to stop smoking or to avoid sun, no, more or less it just delays the loss of vision, no? Oo, so but I think it still helps kasi most of them are slow also. Mabagal naman yung pagwala
Yes.
ng vision, no? Oo. Not all, pero karamihan sa kanila, the retinal dystrophies are very slow, no? So,
Thank you, doctor, for answering that question
oo.
very honestly.
Mm.
Thank
Oo, no?
you. The progression of the sorry, I interrupted you. The progression of some of the illnesses or diseases are slow, but this can even slow it. These preventive measures can slow it down even more.
Yes.
And everybody wants more time. At the end of the day, we want more
The
time.
diet,
The diet. Oh, sige. Talk about the diet.
so actually for some retinal dystrophies like retinitis pigmentosa, they
Sorry, doctor. Just I'll keep it
sorry
because of the
there, here.
microphone. No, no,
Ayan.
yeah. I think it's a connection. All right.
So some retinal dystrophies, no, like retinitis pigmentosa, no, some doctors advocate for fish oil capsules, no,
Okay.
for lutein, for vitamin A, no, because may mga studies that say that it will slow the progression,
Okay.
no.
Will cure will slow the progression.
Yes, oo, pero right now, no, at least personally, no, and the way I was trained also, no, the data nowadays, no, show, no, na baka anecdotal lang yung results of the
Mhm.
studies, meaning we're still really not sure if they're effective, no. So I tell my patients, no, if you have the budget, no, to get all those kinds of vitamins, no, yung fish oil, no, by all means go ahead, no. You can, no, pero if you want to save up, no, I'd rather that I think kaya na yung 2 to 3 times of fish, no, if in a
Yes.
week, no. I think that's good enough already. Green leafy vegetables, baka kaya sa diet, no? Oh,
Okay. What if you're allergic to fish? Eat more green leafy vegetables
yes, the green leafy vegetables.
and
Spinach,
carrots.
yes. Carrots, very good also. Lettuce, no?
Unless
So,
I like Bugs Bunny. Duck.
because right now
Okay.
we don't know eh. So,
Don't know if it's
so yung, kasi if you let them spend, no?
yeah.
Tapos, hindi pa naman sure talaga dun sa effect, no? Parang wag na lang muna, especially sometimes genetic testing can be expensive, no? So,
Yes, doctor. Thank you for mentioning that part and for being the type of doctor that doesn't, make their patients spend so much. Oh, sige, get this, get that. Sure, parang as you said, they might be anecdotal. Like, does that mean? Am I understanding this correctly? Like, maybe maybe people have been taking these supplements and eating carrots, but they've also been getting treatment. Like it doesn't scientifically, it's not proven that it actually helps. I mean, you can get a source of vitamin A and all that from and whatever in the fish oil, but it's not really scientifically proven that it really helps.
oo, hindi pa unsure. Pero I want to focus on vitamin A also, ha?
Yes, vitamin A.
Actually, with vitamin A, if my patients, if they don't have genetic testing results, I
Yes.
make them stop taking vitamin A kasi there's one gene involved, no? That if you take vitamin A, mas bibilis yung pagkawala ng vision, no?
Okay.
So,
Yeah.
so pinapatigil ko muna sila if they don't have genetic test results. Oo.
Okay, but can they like eat carrots and carrot cake?
Okay lang, oo. But yung special that they really take, no?
Yeah, because
No.
there's all sorts of vitamins
Oo.
talaga.
Oo.
Vitamin, and then you're doubling up so much on these supplements. Okay, doctor, what basically what is there anything else you'd like to talk about when it comes to genetic? Something that you'd like to advocate or, something you feel like we haven't gone through in our discussion?
So you mean like advice, no, for these kinds of
Ah,
people?
yes, other advice to give people who have genetic eye diseases, or who may suspect that they have it because their family members have it,
Well,
or maybe they're freaking out right now. Don't freak
um,
out.
yes, so for these people, no, with or without genetic eye disease, no, I really advise them to have, of course, no, regular eye exams, no, that's a given, no, kasi the most important thing really is to protect your vision, no, and the earlier a disease is diagnosed, even if it is not genetic, the better, no, so para ma-monitor natin, no, and yun nga, healthy diet, wear protective eyewear, no, smoking, avoid, no, but I also want the patients, no, to educate themselves, no, especially if they know their genetic test results already, no, kasi hawak na nila yung results eh. So I give the results to the patient so that they can research on the disease also, no. So pag may makita sila sa Google, they can bring it up to me, no, kung if it works or not, no. So I want them to educate themselves also if they have the results already. And lastly, no, kapit lang, no, for the patients, no, don't lose hope, no. Again, there's no cure for genetic eye diseases, no. Isa lang, yung nabanggit ko kanina, no. But madami talagang clinical trials on the way, no. And I think the most important thing is to get a genetic diagnosis, no. So they have to remember they're not forgotten, no. Marami pang tumitingin sa kanila, no.
And doctor, okay, you said there's no cure for genetic eye diseases,
Except one.
but
Ah.
go ahead.
Hindi, except one, Ma'am Nicole, except one. Not, no cure for genetic eye diseases, except one, yung nasabi ko kanina.
Except one, okay.
Yes.
Because it comes with gene therapy.
Yes.
So, like as you were saying, in time, when gene therapy is used more for ocular genetics, there may be more cures that for different types of inherited eye diseases that will come in time. And you were saying technology is pretty fast. Like what is gene therapy like? What exactly do you have to go through when you do that?
So for the eye, no, gene therapy involves, di ba, remember I was saying 1 copy, 2 copies of the gene are
Yes.
mutated, no? So in gene therapy, they create a new copy of the gene. That's
Okay.
normal. Then
Yeah.
they put it into a vector, parang messenger. Then they inject into the eye, no?
Okay. Diretso.
Diretso, they inject into the eye, inside the eye, no? So that's gene therapy. Pero remember nga, yun nga, we need to know the gene. Kasi
Yes.
the exact gene is yung kailangan ma-target.
Okay. Given let's say, come up with a hypothetical situation. Given that you know the gene, the patient knows the gene, it's determined, and then they're going to have gene therapy. They'll make a copy. How do you make a copy of a gene in a lab?
In the lab, mas alam na nila yon. In the lab, yeah,
And then take the gene with the right spelling, as you said. I mean,
Right
not
gene.
as you said, but sort of like the gene with the right spelling. Okay, and it's a messenger, so they inject it in the eye. That when they inject it, that messenger, what does it do? Does it tell the other what happens to the 2 copies that they have that are?
So what really happens in genetic diseases, if you have a mutation in the gene produces the wrong or abnormal protein that makes our body function. So when you insert the functioning copy, no, yung proteins na produce are normal already, are at the right level.
Okay.
So
And the other 2 genes, do they just die out or sit there, or they're like, oh, we'll just relax?
yeah, wala na. You're producing already the correct
Okay.
copy of the protein. The correct protein, the level, no?
Okay. Okay. So I mean, so this is something that didn't this have something to do with our vaccines also that were made, the messenger
Yes.
or not?
Diba they
Yeah.
used it's the
mRNA.
same, they use the viral vectors, no? Yung
Yeah.
virus na hindi nakakakos ng disease, yun yung messenger sa sa gene therapy namin, no?
Because a lot of people freaked out. They will change it.
Oo.
Okay. So it's great to understand it this way.
Oo.
Thank you for being so clear and for giving us all this information and advice. And you even took us through the step of like what they do if you actually join a trial or treat the illness with gene therapy. And is it only 1 injection or many injections?
So far, no, the studies for the one that we have already, no, siguro mga multiple injections, no? But kasi kaka-start pa lang niya since 2018, so we don't
Yes.
have yung kung gaano katagal pa
Yeah.
siya effective, no?
Yeah.
So we're still looking at that, but it's already FDA approved already, no? So
Yes, and then of course it's good to know what's happening and what's coming up. For a lot of people, like things that are in motion. It's good. It updates the program. It updates all of us with the new things that are happening and give people hope. And of course, when you inject people in the eye, I'm sure you put them in a relaxing position, and you probably keep their head in a space and open it for them because it's not
Yes. Tulog sila, Nicole. They're asleep.
okay. It's not like when we were kids and you were like, I'm gonna dare you to look straight into this while I put it in your eye and I'll see at what point your eye can close. No, it's not
Oh.
like that. Sleeping, it's okay. All right. Doctor, is there any other? Oh, no, we still have time. Okay, so why don't we take a short break and we'll be right back and just kind of wrap up our conversation. And if there's anything else you'd like to talk about or put forward or advocate for, Doctor, we can certainly do that. AJ, let's take a short break. We'll be right back. This is Healthline with Makati Med. I'm your host, Nicole Jacinto, and we're here with Dr. Ibanez, who I'm having such a good time with. All right, we'll be right back. Stay tuned.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝘁𝗵. Available for outpatient care services, our 𝗛𝗶𝘁𝗵 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗛𝗶𝘁𝗵 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗶𝘁𝗵 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝘁𝗵.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto, and I'm wearing an overall today. And we are talking about ocular genetics, and we have an ocular geneticist with us. That's his specialty, and Dr. Ibanez. Of course, he practices in Makati Med. And Dr. Ibanez, you said that it is a subspecialty, and there are only 80 people in the world who practice it, and we're so lucky that you're one of them. We're so lucky that you're here in the Philippines, and that Filipinos can come to you and see you in Makati Medical Center. And you do work with a team, as you said. You refer people also to low vision specialists, and other ophthalmologists, and other ophthalmologists refer patients to you. And you have studied abroad, research, you've trained for it, and you are the expert basically here. And I mean, having one of the 80 people in the country is really I think it's really something that it's a blessing to the people here who need treatment for genetic eye diseases. And Doctor, thank you so much for being so informative on the program, for being honest with the answers. And we can tell from how you personally that you personally are a good person, because you don't wow, that was like too many personal. You don't want patients also to spend unnecessarily. You've given us the benefits and the risks of genetic testing. Apparently, you also have to consider that beforehand, no? Even before genetic testing, because privacy may be invaded and discrimination may occur. Do you know if that occurs in this country? Discrimination. Well,
I haven't encountered yet, no, not yet.
yeah. But there's discrimination for so many other things, and we have to get that stigma out. And if we can as a society, ayan, nagtalumpati na ako. As a society, we should really work on it, even when it comes to medical conditions. You can see how it is for persons with disabilities, or even if it's not a disability, it's an illness. And, for older people, because there's this impression that younger people make excuses, which can happen because how many times you're absent when you're in grade school, doctor? I mean, or whatever.
A lot.
Diba? How many times na when it's time, when it's math class, I have a headache and I'm in the clinic. When it's Filipino class, I have a stomach ache, I'm in the clinic again. But we've all done that. But we're serious now. Like, there's an impression that a lot of people use these things as excuses not to perform. But when you're older, a bit older, it really does affect you, but you're still so vital also in so many other ways. And you have so much to contribute to society. And it's just, sana we don't add another layer of discrimination. There's already sexism, there's already misogyny, there's already class discrimination, all types of things. And sana that doesn't happen in the medical community. And I think you're one of those doctors who can help us do that. Doctor, is there anything you'd like to say since I've said my piece? Anything you'd like to say? Anyone you'd like to?
Yes, oo. I'd like to tell the genetic eye patients, that they're really not forgotten, Kasi these are the sets of patients na, syempre from the start, it's a new thing, So at least for the eye, so nasasabihan sila na wala ng pag-asa, hayaan na lang. But there are a lot of treatment already. Siguro we don't have time to discuss. Ang na-discuss lang gene therapy. But there's stem cell, Stem cell is also being studied for genetic eye diseases,
Can you come back on the show and discuss that?
No, I think I won't be the expert for stem cell, but it's one of the treatment modalities being discussed, Another thing, of course, is low vision, Tapos, we're very lucky in the Philippines. We actually have a Philippine Ocular Genetics Interest Group, There are actually 2 of us, out of the 80 in the world, who trained in ocular genetics purely. And in the group, there are, I think, 7 of us who are experts in at least one field of ocular genetics, like retinal dystrophy, ganyan, bago lang kami lahat, So, I mean, the manpower is there to see the genetic eye disease patients, So, you just have to have your eyes checked, I think we're distributed in Manila, in the hospitals, in the big hospitals, yeah.
And for those who want to, who are saving from the province and other areas, or Visayas, or other areas of Luzon and Mindanao, if you're gonna come to town, maybe you want to have your eyes checked, right?
Yes.
Thank you so much, Doctor, for being on the program. We're out of time for this week's show. I really did enjoy myself with you, and I hope that all the information that needed to reach the people who it'll benefit the most will remain out there, and that it reaches them, not just through this live broadcast on DZRJ 8:10 a.m. Radyo Bandido, on the radio, and through on Radyo Bandido TV, but also through Facebook and YouTube. And you please watch the show again and again, get the information you need, and then check out Makati Med's website also. And thank you so much, Doctor, for being on the program. Anything, I'll give you the floor for the final words.
No more na yun na. Just for the patients, kapit lang.
Okay, thank you, Doctor. Probably see you soon. Okay. Thank you.
Thank you so much. Okay. Should I leave already, no? Thank you. Bye-bye.
Hi, everybody. We'll see you next week, Monday, 5 to 6:30 p.m. This is Nicole, Jacinto, your host for Healthline with Makati Med.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests